Heather Roy, you said earlier that we are facing times of unprecedented economic crisis. Paul Adams, what needs to be done to secure the health budget given the global economy and its impact on New Zealand?
I think the global economy will always rise and fall. We've had recessions before. And so as far as the Family Party, as we work through this challenge that we face as a nation, and we will come out of it, and I believe we will come out of it very well, but we need to recognise that this is hurting our families. And I think that headlines that we say sometimes all sound very similar and very well, but we have for too many years now gone away from what is the bedrock, basic, traditional family, mum, dad and the kids. And we haven't taken enough concern how mum, dad and the kids are surviving in our economy and in our health system. And there is a lot of pressure on families. There's fathers that feel that they don't spend enough time with their kids. There's mums that are having to bring up 4 kids and also go to work and have a second job. And therefore the families do suffer. So I think it's a very wide-ranging issue, but we must come back to how well are the families doing in our country. And as we do go through this economic crisis, we want to focus on that first. That's why I disagree with Heather. We need to remove GST off their basic food items and their necessities, because families need to be able to afford to feed their kids good food and to feed it well. We need to get back to more of things that are just basic fundamentals in a family, because if the family's economy is not working well, then the country's economy will not work well. And I think this is one of the problems. You know, one of the old sayings that my grandmother taught me, she said, if the incoming is less than the outgoing, the shortfall will be your downfall. Now that works irrespective of how many zeros you put on the end of it. And so therefore, as a country, we cannot just afford to give out and give out and give out. We have to make sure that things are balanced and correct. And surely the families of this country must be our first focus. Let's make sure they're working well, and then the country will work well.
Heather Roy, just very quickly, how would ACT lock in a secure health budget?
Well, we need to look very carefully at what we can provide. What we can provide realistically. There's unmet demand, and there always will be in health services. We need to look at what we think the government can fund realistically, and then look at the best way to actually empower people to fund the extra health services themselves. We spent an extra $6 billion in health since Labor came to power per year. What we would have been doing for very little gain, what we would have been better off doing is giving every man, woman and child in New Zealand a basic health insurance policy so that they could choose to go publicly, or if they needed to access care that they couldn't get in the public system, to have gone privately. It's about choice. Empower people, give them choices, and actually they are best placed to make those decisions for themselves, not the government on their behalf.
Thank you, Heather. We're out of time, unfortunately. The summing up begins. 1 minute. Louisa Wall, could you please tell the people of New Zealand what your key priority is for health?
Our key priority for health is to continue to invest in infrastructure. We've built 7 new hospitals in our term, we've refurbished another 11, and we've built 10 specialist services, whether they be in the children's health or cancer control or a whole lot of other specific areas. Obviously, we will continue to build on the doctors, base number of doctors, the base number of nurses. We will also ensure that our frontline medical staff are paid adequately. And we would have seen recently that we've settled with the junior doctors and they've had an 8% basic salary increase. We will ensure that going to the doctor is affordable. So for under 6-year-olds, it's absolutely free. Prescriptions now, you won't pay more than $3 for most medicines. So the average New Zealander can go to the doctor for less than $16 a visit. Under National, I think they're going to open it up, so we'll be back to paying $65 to go to the doctor, which will make that incredibly inaccessible for our people. So for us, it's about getting the core infrastructure right. But what I do want to say
Heather Roy, I'm sorry we have to move on. We're out of time. Could you please give us the key issues for the ACT Party?
Yeah, it's about funding patient care. It's about getting that money to the front line where it should be. It's about putting doctors and nurses and health professionals in charge rather than bureaucrats, and it's about providing choice for patients. Patients should be here at the top of the pyramid, not here where they are at the bottom. Their concerns, their healthcare issues need to come first. Prevention obviously is important for the future, but we also have to tackle the very serious issues in terms of workforce issues and waiting lists and issues like that head on as well at the same time. So we need to prioritise, work out what we can do, give people the ability and the choices then to get the healthcare where they can. And I think a key to that is good public-private cooperation.
Jonathan Coleman, 1 minute please for the key health priorities for National.
Sure. Well, look, we've got to actually focus on the services that New Zealanders need. We've had 9 years of a massive increase in bureaucracy. Spending's gone from $6 to $12 billion a year, yet fewer people per capita are getting elective surgery. People are waiting on trolleys in hospital corridors. The system is failing and New Zealanders are telling us that. We're going to maintain health spending, but we're going to get far better value for money. We're going to focus the money on frontline services so people get the operations they need. We're going to make sure that doctors, nurses, all the clinicians, that they have a say in how the health systems run. We're going to end this culture of managerialism, where the managers are running things, where the people at the coalface don't have a say, and we are going to focus relentlessly on providing those services that New Zealanders need, because at the end of the day, after 9 years, Labour hasn't got the answers. We need a change of government and we need to deliver a health service to all New
Jonathan Coleman,
Zealanders.
thank you very much. We're out of time again. Paul Adams, last word to you. What is the Family Party going to focus on as the health priority for New Zealand?
Well, the Family Party's focus will always be people, because if you have healthy families living in healthy homes, well then you won't need such a bureaucratic health system. We want to focus, I agree with Heather, in that we need greater cooperation between the private and the public health sectors. I would like to see any health insurance policies made tax deductible. We do need to bring more assistance to the frontline health professionals that we have in this country, and there's no point in just throwing money at things. I believe in many of our government departments we are not results focused. We will say that it's working because we have added $10 billion to the budget. Money in itself does nothing. It is the people that are working in the systems that actually produce the results. So I want to see greater, I hear more from the doctors and the nurses that are working. They know exactly what to do. They don't need a select committee. They don't need a commission of inquiry to tell us what's wrong with the health system. Just go and talk to them, because I do that on a regular basis.
Thank you, Paul Adams. Thank you very much indeed. Thank you all for your time. To Louisa Wall, thank you very much. Heather Roy from ACT, thank you. Dr. Jonathan Coleman, thank you on behalf of National. And Paul Adams, thank you very much on behalf of the Family Party.
Right.
Thank you for joining us. We look forward to seeing you again for our next election debate, when the topic will be law and order. Good night.